Welcome everybody, and thank you for joining early. I will request that we give ourselves about 4 more minutes as we wait for everybody else to join. We are just on top of the hour, so we can give ourselves about 4 more minutes and allow others to join us for this conversation. Thank you very much. Good morning, good afternoon, good evening, depending on where you're joining us from. Thank you so much for joining us today for the third part of our series of the Coalitions or CHReaD webinars. The theme for the Health R&D focused webinar has been prioritization of health research, development, and innovation in COVID-19 response in Kenya. This webinar has been organized by the Coalition for Health Research and Development in partnership with PATH and the AMREF Health Africa. Today's discussion, we will be focused on local innovations, leveraging on local capacities to address local health challenges. And we have an excellent panel with us who I will be introducing in a moment. My name is John Paul Omolo, the Health Research Development Officer at PATH, and I will be your moderator. Before we get started, I would like to run through a few logistics. We want to hear from you during this conversation. So please share your questions, your comments with us by submitting them in the chat box at any time during this, this discussion. I will be monitoring the chat box and will be saving the majority of this hour for questions. I also invite you to join the conversation online by tagging at PATH tweets, at CHReaD Kenya, and at AMREF_Kenya. This call is also being recorded and will be distributed for those who are unable to attend. We want to make this a conversation, so please, our speakers will have their videos on, and if internet permits, if internet does not permit, then their videos may be off. But for the major part of the presentation or talk, their videos will be on. As I'd earlier mentioned, this webinar and discussion has been organized by 3 entities. That is the CHReaD, or the Coalition for Health Research and Development, AMREF Health Africa, and PATH. And CHReaD is an advocacy coalition and network of civil society organization that was formed in 2015 with a mandate of advocating for an enabling policy environment, increased sustained investment in health research and development, and strengthening of regulatory systems for medicines and other health technologies that improve health of Kenyans. PATH is a global organization with strong presence in Africa, dedicated to achieving health equity to all people and communities, so that communities can thrive. PATH drives public health solutions that keep the most pressing needs of families, communities, and countries. PATH specialties range across health systems, diagnostics, drugs, devices, vaccine, research and development, and policy and advocacy. AMREF Health Africa is an international African organization. Its headquarters is in Nairobi, Kenya, and AMREF currently is running health programs in over 35 countries in Africa. Its main mission is to increase sustainable health access to communities in Africa through solutions in human resources for health and health service delivery and investment in health. To help us put into context our conversation today, a report by the Health Policy Watch, which is an independent global health reporting platform, indicated that COVID-19 pandemic has brought to the fore Africa's resilience on international support for its health sector. And it is also challenging the continent's ability to build up its resilience when donors fall through. There is a new public health order that is coming because of the COVID-19. And the pandemic has opened our eyes to resetting lots of activities, relationships, strategies, and actions. What we are doing with COVID-19 is exactly what we need to do for all the other disease conditions and across the whole healthcare. We will own our space, Africans thinking for Africa and delivering for fellow Africans. This is the new public health order that is coming, and COVID-19 is a way of delivering that public health order. WHO said that the pandemic is not ending anytime soon. In Africa, the message has changed from describing the virus as that needs to be eradicated quickly to one that people can safely live with by following specific guidelines. In addition, the Global Preparedness Monitoring Board, in their report that was titled World in Disorder, further emphasized the need to look inwards and support local communities prepare effectively for pandemics. It stated that preparedness is not only what governments do to protect their people, it is also what people do to protect each other. This level of preparedness must be entrenched in how best we support local innovations for pandemic preparedness. Kenyans have lived true to this statement. We have seen local innovations aimed at responding to COVID-19 get prominence on social media and mainstream media during this pandemic. These innovations have been ranging from ventilators, soap dispensers, standard hospital beds, masks, and PPEs, but just to name a few. These are Kenyan talents that have always been with us and do not need to wait for pandemics to get prominence. We can utilize these talents early before pandemic strike to reduce mortalities, reduce infection transmission, and save our economy. The Global Preparedness Monitoring Board further stated that it would take the world 500 years to spend as much on investing in preparedness as the world is losing due to COVID-19. The big question is, how much do we trust on these local capacities and innovations, and how much do we build these capacities? In discussing today's topic on improving local innovations, leveraging on local capacities to address local health challenges, we are fortunate to have an excellent group of speakers and panelists with us today. And I will take these opportunities to introduce each one of them all at a go. So we have with us, we are honored to have Dr. Louise Simoni Machogu, who is the president of the Pharmaceutical Society of Kenya. Louise Machogu is an entrepreneur privileged to be working to transform Africa's healthcare into a functional and sustainable ecosystem for all through equipped and networked pharmacies and clinics, and that are startups or undergoing change with tools for the access of data for decision making, business coaching, mentoring, and quality yet affordable medicines. He previously founded chain of pharmacies, which were acquired by a larger region chain in late 2019. He's devoted to and enjoys learning more about healthcare enterprises, both startups and SMEs, seeking change and growth. He has previously been recognized with notable awards like the Jacob Wells Awards, Men Impacting Differently, Top 40 and Under 40, Top 100 East Africa Business. And welcome so much, Dr. Louise Machogu. Our next speaker will be Robert Karanja, Dr. Robert Karanja, the co-founder and chief executive officer of Vilgro, Kenya. Dr. Robert has over 15 years experience in global health and life sciences as a pioneer entrepreneurial scientist. He started this research career at ISIPE as an industrial intern at entomopathology unit, where he discovered his love for entomology. This set him on a path of earning a PhD in parasitology and entomology. As a scientist at the Kenya Medical Research Institute, Robert initiated entrepreneurial ventures through partnership with Kenya Industrial Research Development Institute to develop neuroceuticals and phytomedicines products and Strathmore's University Business School, and to design and deliver bio-entrepreneurship bootcamp respectively. Dr. Robert is also a co-founder and a director of the Africa Genome Center and Consulting at a state-of-the-art biotechnology platform that provides genome sequencing and bioinformatics services in Nairobi. In addition, he's an active angel investor and serves on the advisory board of companies in Kenya and the region. We are equally honored to have Ms. Patricia Arua, who is the Deputy Directorate, Business Environment and Private Sector Development at the Ministry of Trade, Enterprise Development. She is an experienced monitoring and evaluation specialist with a demonstrated history of working in the food production industry, skilled in food security, sustainable development and analytical skills, rural development and proposal writing. She's a strong community and social services professional with a master's degree focused in research and development management from Institute for Development Studies, University of Nairobi, Kenya. And last, we'll be having Dr. Amit Thakur, who is the chairman of the Kenya Healthcare Federation. He is a visionary entrepreneur and an industry captain. Dr. Amit has been a groundbreaking pioneer in the industry, in the integration of private sector with the health system in Africa. Dr. Amit has been in the forefront in supporting governments, corporates, health organizations, and governments development partners to foster effective public-private partnership initiatives towards improved health outcomes. He is the chairman of the Kenya Healthcare Federation and the president of the Africa Healthcare Federation. He currently serves as the director with Lumidrugs Ganima Limited and is the executive chairman of the African Health Business. Amit is a founder of the Avenue Healthcare, a Kenyan-based integrated private provider. Welcome, my panelists, and feel most welcome. Thank you so much for joining us today. I think to start us off will be Dr. Louise Simoni Machogu, who Dr. Louise, please talk us through what is the current status of pharmaceutical capacities in the country, and how our capacities in terms of producing medical products for Kenya and the region and the regional market. Karibu.
Thank you, John Paul. Yeah, so thank you, participants and fellow panelists. So I'll be talking through the situation of just where the pharmaceutical sector, the pharmaceutical manufacturing sector is at the moment. This may not just be around the area of COVID, but just generally, where are we? So next slide, please. Yeah, so about the Pharmaceutical Society of Kenya, we are the umbrella body of pharmacists practicing in Kenya. Our main functions is to enhance compliance to ethics. As any profession, you need ethics standards and, for you to be able to, practice in a certain way, professional manner. Health advocacy on matters of policy, and specifically in pharmaceutical manufacturing sector, try to see how we can use evidence or just see trends where we can share with the government to influence policy. For example, if I'll be sharing this later, one of the things we've been trying to push for is can we, as the global fund moves towards exiting, can we have the local manufacturing capacity step in order to build their competence and bridge that gap? Yeah, when the eventuality comes that the global fund will have to move funding to in-state. Yeah, promoting welfare of members, and our members are drawn from various sectors: trade, enterprise, supply chain, manufacturing, frontline healthcare service, and public policy. Next. Yeah, so this is some of the statistics of the country. I'm sure you all know about this. We are 50 million plus in the country. 44.9% of the total population is middle class, and these are the drivers for demand on quality healthcare. So it's actually on the rise. Also, together with that comes with non-communicable diseases such as cancer, cardiovascular diseases, diabetes, and all that. We also have the sector, the market of we are told that the estimate market size of the pharmaceutical sector is 150 billion Kenya shillings. That's 1.5 billion US dollars. Next slide. Yeah, so where are we right now? So we have close to 40 local pharmaceutical manufacturers. I say close to 40 because there are some who are very small. They might just be manufacturing borderline products like surgical spirit or JIC, those kind of things. But we have 37 actually pharmaceutical plants in the country, local pharmaceutical plants. And this actually is something that the participants may want to know. That's actually 50% of the COMESA capacity. These 37 plants actually manufacture a third of our pharmaceutical needs as a country. Yeah, of course, we'd like to see this growing higher, but it's driven purely also on perception. So you have each and every one of us as Kenyans wanting to get, an innovator product, and you all know that we actually manufacture mostly generics. We don't manufacture APIs, those active pharmaceutical ingredients. We import those. We don't manufacture the raw products. We also import those, or at least even if they're to be exported, they go and they are processed elsewhere, and they come back to us for us to use for manufacturing. And you can see there's an opportunity there for anyone looking to enter this sector. The plants are varying degrees of efficiency, with many having unutilized production capacity. There's been a lot of investment in improving the GMP, good manufacturing practices, through programs by UNIDO, WHO, and we actually have a third of these plants actually have GMP level. They can manufacture according to good manufacturing practices. Next, please. Yeah, so some of the challenges we have, and these I'm calling them challenges, but they could be opportunities for anyone listening in. Of course, there's always that story of the cost of doing business in Kenya, cost of power, and to mitigate that, maybe you have the EPZ in terms of getting tax holidays and things like that. But also the EPZ, yes, as much as you'll be accessing the export market, you might be losing out on the local market that is actually growing as well. So there needs to be a balance there. We have a lot of anyone looking to invest in the current maybe manufacturing plants. There are a lot of obsolete equipment. So you might want to bring in new technology and partner up with them. There could be challenges with compliance with the EIA. So this is just environmental assessment that usually investors like IFC, World Bank would want to see before they actually invest. Or even some big banks, Afrexim or Trade Bank of Africa would want to see before they actually touch your plant. So because some of these plants have been in existence for 40 plus years, 50 plus years. Local farms do not have access to markets. So it's just in the recent years that we are seeing our population growing. So East Africa population itself could be close to 250, or even if it has not passed. Kenya, we are reaching 50 million people. We are seeing non-communicable diseases growing. So in the past, we used to just manufacture Me Too products, paracetamol. Now we are actually manufacturing cardiovascular medicine. So that's medicine for high blood pressure. And one of the real success factors in this area is we actually have one of the fast selling cardiovascular medication in one of the regions of this country is actually locally manufactured, as opposed to the ones that are imported. This is actually just a perception from that market and the marketing that has been able to be put in. So one opportunity is even marketing. Yeah, money to be brought in by investors who want to partner and sort of boost marketing to remove that barrier on perception that local manufactured products could be inferior. Other challenge is GMP. Getting GMP certification is an expensive process, and if you're not meeting a certain, because you actually have to get certification for each line. So if a line is making antibiotics, it has to be certified. But maybe the antibiotics are not enough threshold, so there's no incentive for you to even go into that direction. Yeah. If we are seeing the WHO and our board, our regulator, have also worked to enhance post-market surveillance, but of course it needs to be a bit guidelines, though it's not yet reached the required levels for various challenges. Some of them is just the facilities themselves, but also just we are seeing just the whole demand, or the demand for imported products. Yeah, so there's no real need to sort of invest in this sector. There's need for stronger players, investment wise, in terms of investment wise, to attract skills. So you find that there are skills out there, but we actually have to call them. Maybe we actually have Kenyans who are working in other countries, India, UK, US, in some of the technical competence that we require in local manufacturing, but you find the market size is so small, our production capacity. But if you are to amalgamate and grow that from 30% maybe to 50, 70%, you find that, and even looking at the export market, you find that we'll be able to attract these people back into the country. Next slide, please. So what are the opportunities? Of course, the previous slide can also be seen as opportunities. Those are just challenges that can be picked up. We know that the government of Kenya is seeking to promote locally manufactured products just for the purposes of national security. We saw that when the supply chain were cut during COVID, you want to be, you don't want to be told that an injectable medicine is in the high seas. We have to wait for 30 days. So there's I know that the government is working full steam, and the Ministry of Industrialization and Trade can actually speak to this, and also the Ministry of Health. Kenya and the region's growing population, our centrality in the region, the fact that we actually have 50% of the pharmaceutical plants in the region, we have skills that can be shared. There's availability of the skilled manpower, like I said. There's we're actually moving towards market demand threshold for increased competence and skills. So we need sort of to move like into maybe Amit will speak into this, but I know we need to move into mergers, outright buying out some of these plants to sort of give them a bigger vision. And maybe those that can't, if you have money and you want to put in, you might have to go into a greenfield turnkey project instead of just buying an existing ones. But I see the space is ripe for mergers. Sort of you can just improve on the efficiencies that we have as a country. Next. Yeah, so I think that was my presentation. Thank you.
Thank you, Dr. Machogu, for highlighting the opportunities, the status of our current pharmaceutical capacities, pharmaceutical industry capacities, to produce this medical product. It's interesting to see that 50% of our of what we need is, or rather of the local capacities, is within our region, and that it's even serving a third of our local pharmaceutical manufacturers, what is being produced as within this region. I'm happy to also to know that there are quite a number of opportunities that exist, and I'm hoping that after this this webinar, we are going to turn all the challenges into opportunities and make the opportunities stronger, and we take advantage of that. Thank you very much. I think to bring on board our next speaker, just before I bring the next speaker on board, I would remind our audience to please keep your questions coming on the Q&A section so that we can address them. Our next speaker will be Dr. Robert Karanja. And Dr. Robert, what mechanisms has the country put in place to support local innovations? We have seen from the previous speaker the market. We have a huge market already, and we have already, some levels of capacities. So how are we supporting these local innovations? How then can we also commercialize such innovations to address health challenges in Kenya and other African countries? Welcome, Dr. Karanja.
Thank you, John Paul. And I'm going to answer that question briefly just by talking about some of the work that we're doing, but also within that context, highlighting a lot of what the amazing interventions we have now in the landscape for supporting innovation. So I'm going to share my screen. I'm not sure that you can just let me know if you can see it. Oh, okay. Somebody's doing so. Is this me or is it Catriona?
I think.
Okay. Catriona, yes. And maybe that's a good place to start. One quick correction I'll kindly give is I'm no longer the CEO of Bilgrow Kenya. I handed over that role to my co-founder, Wilfred. So my current role within Bilgrow is actually Chief of Research and Innovation. And COVID-19 happens to be something very close to my heart. And so I'll really just be talking about, yes, it's a challenge, but how do we flip that into an opportunity? How do we create economic resilience? How do we create jobs? How do we create wealth? And the key anchor I look at for doing this is the fourth industrial revolution. So this is a little bit different from Louis, who was talking more of the drugs and the pharmaceuticals. So briefly about Bilgrow Kenya. We are a fairly small organization that tends to punch way above our weight category. We've been around in Kenya for the last 5 years and basically operating as a business incubator and early stage investor in health and life sciences. Within those 5 years, we've been able to touch more than 1 million lives through the power of innovation and social entrepreneurship. We've supported over 15 companies that have generated more than $1 million in new revenue and been able to unlock, deploy catalytic capital of about $500,000 that's been able to unlock more than $10 million within that short time. So in a sense, when you talk about health innovation, it is happening, it is real, and there's a lot of activity on the ground. Next slide, please. So what do we exactly do? We work with social entrepreneurs, and these are people who have a double or triple bottom line. So we're basically looking for for-profit companies that are targeting Wanjiko as their target market, and that are being able to produce public health impact as a desired social impact. So they are just as intentional on the social impact as they are intentional in terms of profitability and making the shareholder happy. And what we basically do as an incubator is we de-risk these innovations by being able to provide business development services. And this is the whole gamut from IP to innovation management, helping them to think through the value proposition, build a business model, validate it, come up with a go-to-market strategy, come up with a scaling strategy, addressing all the regulatory aspects that are there, and of course, becoming investment ready. So being able to not just sell their product to the customer, but also being able to sell their company to investors successfully. As I said, our focus is really in the health and life sciences. And as I mentioned earlier, I am a biomedical scientist in terms of my background. And that has been a key aspect of being able to support innovators. So the beautiful thing about Kenya is that there's been a lot that's really been put in place in terms of supporting innovations, not just in health, but across the board. This is just a quick diagram that's bringing out the fact that just last year alone, we had more than $2 billion that were invested in startup high growth SMEs on the continent. Kenya, as you can see, was able to capture about a quarter, roughly just a bit about a quarter of that $2 billion coming into this country alone. And so the question for me, and what I always like to ask the health sector, is how much of that came to health? And what do we need to do to be competitive with the other sectors like fintech, renewable energy, and so on? So it's up to us to be able to open up the health system to take advantage of this amazing infrastructure that has led to that success story of more than $500 million coming into Kenya in just a single year. Next one. And what WILGRO does is really to be able to speak to how do we translate R&D push to creating a market pool. And this is because we typically see a huge chasm between academia, where the R&D is happening. And academia tends to march to their own drumbeat, fairly isolated in the ivory towers, whereas the market is a completely different tempo, a completely different culture. And that lack of linkages between academia and the financial markets and the commercial markets tends to be the biggest challenge. And WILGRO's job is really to be able to take entrepreneurs or scientists who emerging from STEM, such as me, and helping them to be able to speak the dialogue of investors, to speak the dialogue of the market, and to be able to translate the R&D into not just problem solution fit, but into a product market fit. And within that, we've been able to create a knowledge-driven economy and economic growth for all of us. Next, please. We typically focus on 7 strategic areas. Very quickly, I'll just say it's really 3 key buckets. One is diagnostics, where we're looking at point-of-care diagnostics and multiplex diagnostics. The other one is medical devices, where we're also looking at the issues of wearable technologies, IoT, machine learning, and all that. And then the last one is issues to do with access to clean water. And all of these are extremely relevant, especially when we're talking about COVID-19. Within the last, from March, when COVID happened to show up in Kenya, we were able to mobilize and set up a COVID-19 fund. To date, we funded about 10 startups that are coming up with different kinds of health COVID-19 solutions and being able to commercialize them. And further than that, beyond that, we're also partnering with the Kenya National Innovation Agency and the National Research Fund. And hopefully we'll finally be able to put out this call for proposals and for innovative grants of about $5 million that can be able to, again, go towards funding startups. The key thing to highlight about COVID-19 and how do we translate the challenges we have, we basically need to be able to understand the aspects of, when you talk of, for example, ventilators, that ventilators is really just a tip of the iceberg. We need to be able to understand we really do have an oxygen crisis. The availability of oxygen in itself is a challenge for most health facilities. So whether you have the ventilator or not, will not really make a big difference. We need to be thinking, how do we build an ecosystem whereby we're able to bring together biomedical engineers, doctors, scientists, to probe and to come up with solutions. And the reason that we believe health and life sciences is an exciting place to invest is simply because a lot of this market is neglected. Overall, you'll find that typically Africa, the billion population of us, which includes North Africa, not just sub-Saharan Africa, tends to be about 3 to 4% of the global pharma market. We tend to be about 2 to 3% of the global medical devices market. And what that basically means is that even when you see these health technologies, these scientific breakthroughs, when they're being commercialized, they're not being commercialized for our market as a target market. We are a neglected market. We have a broken market mechanism. So that basically means there's an amazing opportunity for us to convert our R&D actors, not into from thinking just as traditional academia, but also becoming change agents, becoming industrialists that can be able to actually take that R&D output and start creating companies that can be able to manufacture, can be able to produce and scale all of these solutions. And so that's why we are really eager to be able to make sure that seed funding is not a key challenge. Beyond that, as you've seen, we also work with investors that are being able to plug in the bigger funding that's needed. So for Vilgro Kenya, we'll typically be working with you in the point of care diagnostic, proof of concept stage, where it's typically 10 million to 25 million shillings. And also to some degree between the 25 million and 100 million shillings investment. And then we also have this amazing venture capital PE capacity that's already very active in this country, looking for opportunities to invest, that we work and partner with. And we basically are building for them that amazing pipeline of innovative, exciting companies that they can be able to invest in. Besides that, we're also partnering with people like NIH that have recently put out a ring-fenced call for proposals, $58 million targeting Africa for digital innovations. And I think the IDRC, so many other players that are really looking at health and life sciences, not just because of COVID-19, but because it's really a low-hanging fruit. And I think, again, within Kenya, especially, we have an amazing capacity for R&D, be it from basic research to clinical trials, implementation research. Is amazing capacity that just needs to be able to move out of the labs, move out of pilotitis to actually creating high growth SMEs. I think with that, I'll be able to, thank you. If we can just go to the last slide, I think that could be it. I just want to highlight one more thing in terms of the other kinds of infrastructure that we do have. We've recently also partnered with academia and also with the government, like I said, people like NRF and Kenya, in terms of launching what we're calling the Innovators Forum. And this is basically a forum that is bringing together a community of innovation actors across the triple helix. So whether you're in government, as a regulator, or Ministry of Industrialization or Ministry of Health, or whether you are in academia, or whether in private sector as an innovator yourself or an investor, we are basically bringing different actors together, primarily focusing on health and life sciences innovation, to be able to ask the question, how can we leverage our various capacities within the health system? We are looking for health facilities that can be platforms for co-creation in terms of being able to provide that feedback loop for innovators. They need a lot of feedback from clinicians, from the target end user, the nurses, the doctors, even the healthcare administrators. And then also being able to work with government. We are really challenged, especially in terms of lack of a health technology assessment capacity that is really impeding adoption and scaling of health innovations. And like I said earlier, investors also need to be plugged in, and also being able to mobilize a lot of the funding that's available, development funding that can go into providing sustainable mechanisms for addressing Africa's health challenges. With those few remarks. I think I'll look forward to questions and answers session, and hopefully have a good discussion on where we can be able to plug in.
Thank you very much, Dr. Robert. Very informative pieces of information there. Very interesting to know that we are supporting, and there's a lot of effort that is going towards de-risking the impact of investment around local innovations through the 5 areas that you mentioned, including navigating the regulatory approval processes, which we all know is a very complex thing. The fact that there's quite a bit of goodwill, over 2.02 billion investment that have come to the country, and I know this should be a music to the ear of government, especially when we are talking about research and development as a return on investment to this country, and linking entrepreneurs to investors, and also supporting local innovators to speak the language of innovation. But most importantly, even as they're doing that, thinking about having the local innovators target Africans for Africans, like their innovations targeting Africans to solve African solutions. And you've given us a parting shot, or a question to think about. How then do we build this ecosystem that would support the innovations? How do we bring everybody on board? And I think we should be able to have these more, even as we are going to our next speakers. When we speak about bringing people together, when we speak about return on investment out of local innovations, and I think this should be music to the ear. And of course, our next speaker is going to be Ms. Patricia, speaking from the government side of it. So, Ms. Patricia, how can Kenya use these opportunities that we've seen highlighted by our 2 previous speakers, such as use those opportunities, but again, you take advantage of opportunities like the non-disclosure agreement and technology transfer as a means of cost reduction for products. We've seen the challenges that were raised by the first and the second speaker around the challenges that we are facing. But again, what opportunities exist for government to invest in local innovations? Welcome, Ms. Patricia.
Thank you, moderator, and good afternoon, good morning, good evening to all the attendees. I wish to thank you, the organizers, for inviting us, and I'm very grateful for the panelists who've spoken before me, because it just goes to underscore the importance of having a concerted effort in addressing the matters that are before us today. First of all, I want to say that from the government perspective, we recognize the size of the pharmaceutical sector, and we know that it is a strength. We have more than $1.2 billion in terms of the pharma market size. And then we know that we are able to export 10% of what we produce locally. And as we go through that, one of the things that we recognize in government is that the manufacture of pharmaceuticals and other medical products fall within the category of what we call high technology manufacturing. And high technology manufacturing also has its competitive advantages. Hopefully this should address some of the issues that the previous panelists before me have said. And one of it is technological capacity and the speed of innovation. And together with that, we're looking at how do we work with other government agencies to access highly skilled personnel from within and without the country. I'll be sharing more on that. Together with that, also high technology manufacturing also has a bearing on intellectual property rights. And I did notice that I think in your first session or so, you invited my colleague from the Industrial Property Institute, and that is one area where we can really support innovations coming from this sector. And also on the aspect of marketing, which has been mentioned by my fellow panelists, we look at high technology manufacturing as a competitive cluster. So then what has Kenya been able to do? With the help of the United Nations Industrial Development Organizations, UNIDO, which one of my predecessors mentioned, Kenya and Ghana were among the 2 African countries that were selected and identified to pilot the development of a pharmaceutical industry under the Accelerated Industrial Development Action Plan, IDA, and this was agreed by the AU in 2017. And now since then, Kenya and the EAC have developed the EAC Good Manufacturing Practices Roadmap, and that has been done for the pharmaceutical sector. And similarly, Kenya has one of the fastest growing innovation ecosystem. And also we have several startups. And together with that, we do support the biggest ICT innovation hubs in Africa. So the government in the meantime has said, how do we support the sector? So we have looked at the matter of standards. You know, we have a standards infrastructure, and our standards infrastructure is well developed together with our intellectual property regime, which is also very well enshrined in our constitution. And this year, we have already done a draft bill to align the Kenya Industrial Property Institute, Copyright Board, and those agencies to fall within the rights that are enshrined in our constitution. So from the government side, we're ready to protect innovations. But within the pharmaceutical industry, we are also proud of our industry because 5 WF organization certified firms are found within the region, 3 of which are in Kenya. That means the potential is big. Now, with this background, Kenya can benefit considerably from signing non-disclosure agreements because they provide opportunities for us to build that technological capacity and to speed up the innovation that we really so much want. You're aware that right now we are in negotiations with the US on the FTA. We are in negotiation with the EU. We are in negotiation with UK since they left the EU, the Brexit negotiations. And in those, we have opportunities of bilateral agreements that can help us have the favorable non-disclosure agreements that would allow for further manufacture of generics. And this, among others, will help to reduce the cost of medicines. Now, during this time of COVID, we have been able to put together webinars, 2 specifically, jointly with the Kenya Association of Manufacturers and the Business Situation Room, which I co-chair, and that was under the Ministry of Industry, Trade and Enterprise Development. And we were able to learn from colleagues in UK, in India, in China, where we have some of the big manufacturers who have got long-standing experience on how we can scale up, how we can build our technology, how we can expand the use of expired patents so that we can also bring about the required development in our country. I think if you've done your readings, you can tell that there's a growing protectionism. Many countries are beginning to look inward. So even for us, we are beginning to analyze our capacity and say, what can we support? So we have the Kenya Entrepreneurship, Kenya Industry and Entrepreneurship Project, which was launched last year within the Ministry of Industry, that is primarily focused on the innovation ecosystem. Together with that, we have the organizations within government, CHReaD, which my colleague Robert has mentioned, that support local innovations. Apart from that, from the time that we started looking inward even more as we experienced the gap that one of my colleagues has said, you're looking for drugs and you don't want to be told that you have to wait 30 days because they're in the high seas. Kenya has now secured a list of 128 pharmaceutical products, which we have put in a gazetted document we are calling the Procurement Master Roll, #1 of 2020, issued by the Cabinet Secretary for Industry. And this guarantees that 128 products and medical supplies will be sourced from the manufacturers who do it locally within the country. That is government procurement secured. So that is good for the market. And on that list, there are 334 items, 128 are pharmaceutical products. Quick math, that's about 38% of the goods on that list. So I think if there is an area that has potential and opportunity, and we are willing to support as government, it is the pharmaceutical sector. Now, while the pandemic was also very devastating in terms of supplies, opportunities arose in the area of PPEs, and medical device manufacturing. As we speak, I have a list of the PPE manufacturers, and I have a list, those are local, and the people who manufacture the coveralls, people who manufacture masks. And in addition to that, just to allay your fears, I also have a list of manufacturers. We have canceled their licenses for failing to meet the standards. So we are taking very seriously the matter of expanding this industry, but making sure that we don't just do business. We want to do business and good business within an environment that supports the health and welfare of Kenyans. So as we plan on continuing to leverage technology transfer and support local manufacturers, what we have done as government is begun to look at the issue of also circular economy. Because since we started the COVID challenge, we have the opportunity, which I see for startups, and maybe we can even borrow from some of the countries we can enter with into this non-disclosure agreements. And maybe there's somebody out there listening to me. How can we take up recycling of the PPEs? That's a new business opportunity. UNEP estimates that the spillover effects of plastics, because now we are beginning to package more, and we want to keep everything in a very sterile way. They estimate that the cost of plastics on tourism, fisheries, and maritime transport is estimated to be something in the region of $40 billion US. That is the cost. How can we use the circular economy to support an industry that will support and complement what is happening in the pharmacy industry? We can upcycle. There's already a company in Tanzania that is upcycling plastic bottles and using them to make face shields. Zaidi, that is Zaidi Recyclers. We have the opportunity to build a circular economy. And with all these discussions and the identified target markets, we can enter into very good, favorable, non-disclosure agreements and begin to build on the innovations that are coming through from our country. So from this part, I want to say that is my contribution. And thank you very much for the speakers before me. And just to guarantee that with government, we are open and we shall continue to engage with stakeholders and make sure that we bring out the best for our country. Thank you.
Great, Ms. Patricia. I think, many a times when we listen from a different quarter, we usually assume government is not doing anything. But I'm really pleased to hear that there's quite a lot of work happening from the legislative processes, working on a draft bill that would be able to reduce the multiple layers of processes that people go through. You are also working on the institutional point of view, putting in the Kenya industry and the entrepreneurship, CHReaDs and the rest. Working on the operational side, making sure that local manufacturing is happening, but also making sure that substandard and falsified standards or medical products do not get it to the market. That is really brilliant, and I'm happy to hear that. And of course, challenging us and providing opportunities for business people, on what is currently happening and how can we take advantage of that. Thank you very much. I think that is very, very informative from the government point of it. And we look forward to engaging you more, even as we advocate for, local innovations. And I will just call on to our last speaker. Dr. Mead, you've heard what the government is doing. You've seen the opportunities that are happening. How are we doing in relation to, our previous pandemics that have happened in Africa? What lessons are we learning from the previous lessons? Have we taken good advantage of the past pandemics like Ebola? Have we been able to build local capacities to be agile enough to prepare and respond, to such pandemics, learning from the previous? So welcome, Dr. Amit.
Thanks. I hope you can see my screen.
Yes, it's clear and you're also very audible. Thank you.
Okay, yeah. I mean, I really thank the other speakers who've talked about collaboration, and I think everything is about innovation, collaboration. What pandemic has taught us is that working together is working successfully, and countries, including Kenya, are learning a lot because of this pandemic. Let me take you through some of the points on this topic. Yeah, just 1 second. So if, John, the topic provided to me was on how countries, including Kenya, are drawing from these lessons in responding to COVID-19, having had the experience and epidemics such as Ebola in the past.
Sure.
Look, as quickly as I can, Kenya Healthcare Federation is the health sector board of KEPSA. We've got a long journey of 17 years. And through this journey, we've established almost another 24 countries in Africa, which are supporting public-private partnership. Our vision, mission, and core values are on our website. But really, I want to talk about that the private sector wants to see an enabling environment that supports quality, affordable healthcare for all. And if you see the network that we've created in our national level, regional and development partners, not only are we the ones that co-chair the Ministerial Stakeholder Forum, but we also presented the Presidential Roundtable. And the same kind of model we are using in East Africa, working with Africa CDC, Africa Union, and many other development partners. This is just to show you from 7 organizations in Kenya when we started, how many more companies and organizations have joined us with one vision of creating an enabling environment. We have professional associations, we have institutional, and we saw the number of companies. Some are listed on the stock exchange and some are SMEs. One example that we are very proud of is the Wheels for Life. We've received 30,000 calls, assisted 1,300 mothers, dispatched 478 cabs and 205 ambulance trips during curfew to save hundreds of women to deliver safely during these difficult times. We've done so many seminars, webinars, engagements when we were in the beginning talking about cessation of movement, quarantine, locking down. When we talked about Kwale, we talked about Mombasa, Old Town, Eastleigh. So lots and lots of engagements in Kenya. Let me now go to my topic, which is really about Africa response and what we've learned from Ebola. And like Margaret Chan said, that this outbreak has taught us many lessons, including leadership, coordination, technical support, logistics, many of these points that were mentioned by my earlier panelists so aptly. I want to share at this forum 7 key points, lessons from the past, what we have learned, and how we think we can be a stronger country and a stronger continent. And they will be in the order that you see here: food, health system, livelihoods, governance, stigmatization, engagement, women and girls. You know, when Ebola was fully outblown in West Africa, food insecurity became really a major issue. We've seen it here. You can see in Congo, where there was during the COVID pandemic, 86 kilo bag of yams was being sold at 200% of its initial price. So I'm sure we've all seen it. We've seen what's happened to commodities in our country just because of shortage, not only for masks and PPEs, but also for food. So food security is a key lesson learned. So when we lock down and we have controlled movements, it should not stop movement of food during the crisis. That's one lesson. The second lesson that we all are talking about, because we are in the health industry, is about the health systems approach. And it's clear that so many other essential health services get ignored. And there are lots and lots of studies. And because you asked me to talk about Ebola and lessons learned, this was one such lesson, that twice the number of people who died from the outbreak eventually died from preventable outbreak of measles in DRC. So when you ignore other conditions while we are busy dealing with COVID, I wonder how many more mortalities and morbidities we will see. So the lesson learned is that we should not ignore essential health services. The other lesson we've learned is that you can't do it alone as a government. So leaders in our countries and ministries of health, ministries of trade, commerce, and at the presidential level must have clearly seen that if you work with partners, I think we can save more people. Government can't and shouldn't do healthcare alone or even build the economy. So leveraging private sector was a true test during COVID. The countries that did not leverage private sector have seen worse outcomes than the ones who did. Manufacturing as a base, where we repurpose our factories to start producing PPEs so that we can save our doctors, nurses, and healthcare workers, is an example. But what it has also led to us thinking is new innovations that we can also serve the global industry and grow economy. One such is digital health and telemedicine. People who travel to other countries like India, and we spend what, $1.5 billion every year. 95% end up going to India for medical travel and treatment. And during COVID, everyone had to be treated here. So maybe we need to start the digital connection, and we need to enhance our services locally. We need to open up for innovations and transformational organizations and create an environment, not create roadblocks and regulations that get stuck at the Attorney General's chamber for months and months before licenses are given. So slowness around government regulations is the best way to stop companies to progress and create more jobs. So we need to get government to move out from bureaucracy. Livelihoods and economy. You know, on this slide, you can see that we practice social distancing, self-isolation, and these are the reasons why so many people must have reduced their income. There was a big debate between lives and livelihoods. Even our president started talking about that balance. At the meetings that we had with CS Matiangi, CS Kagwe, this equation between lives and livelihoods, curfew, lockdown, cessation of movements, were all to ensure that the informal economy continued. You can see from Ebola what happened in Sierra Leone and Liberia and how much of the income dropped. So what is the lesson learned? The lesson learned is that relief packages in wealthier countries enables people to cushion these kind of emergencies. In our countries and in Africa, we need to think innovative. We just can't afford the same package. So when we were trying to help the vulnerable, there was a limited bandwidth of how many we could provide 1,000 shillings cash transfer on a monthly basis. There was no way we were going to give a cushion or a social economic security to the ones who needed it. So the lesson learned is that multilateral organizations, aid agencies need to be cleverly organized in a strategic way to deal with the pandemic. When we deal with our donors and development agencies in a way that is not transparent or not well organized, it is the beginning of a problem in any country. Whether it is dollars for PPE or COVID, or whether we have the KEMSA situation, it's just that the way we deal with our development agencies could be enhanced so much more to improve livelihoods and economy. Governance is a big issue. We've been learning about governance almost for 100 years. And in Ebola, you can see, and in other outbreaks we've seen in Africa, just one, rumors that maybe a vaccine has negative effects, or rumors that this COVID-19 is only for those who travel from abroad, are reasons where we have vaccine boycotts, public views about that the vaccine is laced with the virus. And these are the kind of things that leadership needs to play a big role. So how have we done, and what are the lessons learned? We need to engage local authorities and local communities much more. We know that the messaging that we've had during this pandemic has got mixed reactions. I think the daily reports that we get are wonderful. It needs to be enhanced so that the Kenyan population and many populations in other parts of Africa get to see a progressively more scientific rather than just a number reporting game, so that we can regain trust and consent required to engage the local leaders. So the role of local leadership is being amplified. Wherever you see a poor leader, you can see they are being summoned to the courts. Some of them are being put behind bars. The role of the local leaders is either greed, where they're looking after self rather than community. They should also be put to the book, and the discipline index must be published, where it's about time we name and shame the ones who need to be put behind bars. Should be put straight behind bars, sparing no one across the entire continent, because this is about life and death. Stigmatization is one more lesson that we have learned. The long-term consequences of having a new form of stigmatization due to COVID can damage society. People were literally scared in the beginning because they didn't really know the preventive measures. But the greatest enemy we face is not the virus itself, it's the stigma that turns us against each other. At one point, it was being called like everyone from China are the ones responsible to what has happened. And there was negative reactions from many quarters, sometimes also against foreigners. They've been targeted in Ethiopia and Kenya, as we've seen, as carriers of coronavirus. So this is another lesson learned we've seen from Ebola that we would like to share on this forum on COVID. Community engagement and mobilization. We all know this is important. The information on behavior change is critical. When we talk about funerals, where we have large gatherings, or cultural practices, where we have traditional gatherings, prayers being for communal prayers or communities coming together. And this has been a huge lesson learned, because I think preventing the spread of this pandemic is an individual responsibility. So community engagement and mobilization will remain for many, many years as a key component of strengthening the health systems across the country and continent. Finally, I must just mention about women and girls. It's very critical to talk about the lesson learned here. And through an imbalance, the hardest hit demographics are women and girls in any emergency and outbreak situation. We've been mentioning this. We've been talking about domestic violence. We are talking about rape cases. We are talking about maybe sexual abuse. And I think diverting any resources from women or child health to other things will leave them even more vulnerable. So we've learned lessons about sexual reproductive health services that need to be ring-fenced, and we should not sacrifice them because of these pandemics. It's important that childcare and protection services are instituted. We've done a lot. I think we opened counseling services, we opened call center. We've had great public-private partnership in Kenya. I'm really proud of the institutionalized approach we have. We are part of the Ministry of Health Task Force. We discuss online, offline, all the time about this. We were involved when donations came in. We were also involved in mobilizing more staff so we can have more testing and open up private centers for testing. We were also involved in when we're designing infection prevention control. So I think Kenya has got a lot to be proud of, but at the same time, there's a lot of lessons that we can share in this presentation. So I'll stop here and hand it over back to you, John.
Thank you so much, Dr. Amit Thaka, for highlighting quite a number of areas where we've learned lessons, places where, of course, if we had taken advantage of the local innovations or the local capacities, then maybe we would have not spent as much time or as much resources. Mentioning that COVID-19 is not an excuse to ignore other essential services. I think that is a very powerful message. And, cooperation, working together is the key to, addressing our African challenges and Kenyan challenges. Digital health is a key thing, and thank you for raising that. And the fact that transparency is, transparency in working with development partners and also other key agencies is a key item to observe. But also we are looking at such kind of opportunities, taking advantage of conversations like the one we are having today, to create that level of transparency. Today we've had quite a lot about what government is doing and what other private sector and civil societies are doing. I'm seeing quite a number of questions that have come in, and I'm hoping that we will address as most as we can. So I will be reading through some of these questions and directing them to different speakers. So if we don't answer all, please be assured that in our final report, we will have our speakers respond to them and include them in the final report. So the first question, I think, goes to Dr. Amit. And allow me read for you about 2 or 3 of your questions, and then I'll also give the others so that when we are responding, you can respond to all the questions that are there. So the first question is, Dr. Thacker, what policies, partnerships, and accountability mechanisms needs to be put in place during the COVID-19 pandemic to sustain the focus on local innovations and action and avoid lapsing back to old ways? The other question for you, Dr. Thacker, is what efforts is the country putting in promoting innovations for health, support for private sector and government, as seen mobile or IT related innovation enter the market successfully? What lessons can be drawn from these to promote entry of other local innovations into the market? And maybe I'll keep it to that for you, Dr. Thacker. The other question that has come in for Dr. Machogu is, local innovators have experienced a lot of barriers when trying to introduce medical products in the country as a result of long and bureaucratic processes, which involves going through multiple regulatory bodies. What has the Pharmaceutical Society of Kenya done during this pandemic to help reduce time taken to introduce products in the market? The other question for you, Dr. is, no, there's a question for Dr. Thacker again. Sorry, I missed. Dr. Thacker, the last one is the public-private partnership initiative is a classic example of how local innovations can scale up in the country and supported by government. Sorry, the public-private partnership initiative, a classic example of how local innovations can scale up in the country and supported by government and other entities. How can you, as the chair KHF and president African Health Federation, ensure that government support local innovations through PPP? What opportunities exist and how can one take advantage of such opportunities? To Ms. Patricia. To Ms. Patricia, local innovators who are not attached to an institution face deep barriers for regulatory and commercialization of these innovations. What is being done to guide these innovators and support them to bring their innovations to the market? Note that some of these innovators are not aware of the regulatory processes and have reservations towards government systems that are unclear and difficult to navigate. Another question to Patricia. Kenya has very little or no incentives to promote and support local innovations. What is the government doing to improve on this? And what do you see as the role of private sector and civil societies in helping unlock this challenge? And the last for you, Patricia, is Ms. Ms. Arua, or what efforts is your department putting in place to share this information with public to spark confidence and interest among Kenyans? And of course, we have for Dr. Karanja. Dr. Karanja's organization has been named as an incubator and an early stage investor in health sciences. How do you work with local innovators within research institutions and academia to give life to their innovations, and especially navigating the complex processes of introducing products? I'm not sure whether you have any other one, Dr. Karanja. Maybe we can start with Dr. Amit, kindly.
Thanks, John. Also, please accept my apologies because after this round of questions, I'll have to jump off because of another commitment. But let me just put all the three questions together. All of them are very good. What's coming out clearly in this pandemic is that the way we are dealing with local innovations in healthcare in Kenya needs to be taken to the next level. Far too long, and far too long we've left them without supporting structures that are adequately positioned to enable them scale up. In fact, maybe it's become so difficult for innovators that some are losing hope. They're losing hope, almost thinking that if you don't have a network or a connection that is either at county or at government level, then consider yourself not fit for purpose in doing business. That disappointment of a new company and a new innovator and the youth will provide what you call a decline in our progress. So I really thank those questions. So talking about policies, partnerships, and accountability. So local innovations and in mobile ICT, digital, or taking them to scale through the PPP initiative needs to be placed at two major areas. One is at the national level in the ministries of health, and revive some of the organs like the VDS, Vision 2030, revive some innovations hubs that we had created, but they are currently all very weak. So I think, in my opinion, there is need. The second one is COG at county level. I think there is great potential for counties to embrace a model of engagement with this under a partnership. The partnership needs to be multifaceted, and as KHF, we will be putting a strategy together so that the local innovators and exciting innovators and young innovators can scale up and get funded, but be mentored as well so that they can bring their products and services to scale. And this accountability question will be really a governance question so that we don't always have to bend the rules to get a tender, and the days of tenderpreneurs should be labeled and expunged out of our system. I think I've answered those questions, John, for the lovely engagements I've had from the panel. And thank you for this opportunity.
Thank you so much, Dr. Amit, and thank you for joining. I know you may be dropping off for another engagement. We really appreciate. If there are any questions that will come in, I'm seeing some are coming in. We'll be sending them to you on mail, and then you can respond. We'll include them in the report. Thank you so much. I think, yeah, I'll give this opportunity now to Dr. Machogu.
Hi, John Paul.
Yes, I can hear you.
Yeah, so for me, the question was, I think I only had one question, didn't I?
Yes, so far, yes.
Okay, so I think the question was on what have we done in terms of getting our getting members who, or not even members, because we're a membership organization. There are people who want to register products. I think at that time we started getting a lot of inquiries around people registering test kits Of course, there's a balance between entrepreneurs and actual people who have the needs of the public at heart and wanting to accelerate that process. I know what we did, especially through, because PSK is a member of CHReaD, and through CHReaD, we are able to attend the presidential roundtable and the ministerial roundtable, especially the one by the Dr. Matiang'i. And what we were able to do is raise those, and even working with the Pharmacy and Poisons Board, and they actually have mechanisms right now. And if there are any actors out there genuine actors who feel that they're being locked out of a process, they can actually reach out to ceo@psk.or.ke with that, and we'll follow it up through for them. Yeah. Thanks,
Thank you, Daktari. There was another question that came in. Sure. I don't know whether I can just raise it for you. It was from an anonymous person. Okay. It was, let me just scroll through it. Okay, let me, as I find it within the questions, I'll ask Ms. Patricia to speak, then I'll send that to you, Daktari.
Thank you very much. I want to address 3 questions that were given, and maybe start by introducing again the department that I work for. It is called Business Environment and Private Sector Development. So in terms of having somebody you can use to access the ministry and all its facilities, whether in the agencies or in the mainstream ministry, please just call on the Department of Business Environment and Private Sector Development. I think that opens the door now to where you can have engagement. If your issue is around chemicals and minerals, then we have the directorate that deals with that. If your issue is around Kenya Entrepreneurship and Industry and Entrepreneurship Project, then we get you to that particular company. If your issue is around standards, if it's around intellectual property, I think this addresses the issue of how local innovators feel that there are barriers to how to go to government. So I'm giving you an option of how you can access these government services and agencies through the Ministry of Industrialization, Business, Environment, and Private Sector Directorate. Even if you cannot get hold of me, just go to the website and write to the PS, and that information will get to our department and we'll do the linkage. Secondly, we are looking at the pharmaceuticals and medical supplies sector. In our analysis, we have looked at 3 areas. One is the areas of APIs. And we have found that the API may not be very feasible because of the cost of investment. The value that it takes is very expensive. So this is an area we're saying, let's deprioritize, because we really need big time investors and assured markets to be able to get the APIs done locally. But we have high value finished medicines that government has seen a strong interest in the manufacturing sector. And we have seen also the possibility of attracting international manufacturers. And these have a higher ROI, return on investment, than the APIs. So in that respect, what is the potential action that government has? This now addresses the question that was asked about incentives. The government is looking at how to do some sort of bespoke incentives specific to the guy who comes around. We look at the investor and have some sort of conditional incentives tied up to his investment, so that that helps us to get the end product that we are looking for. So we are looking at that flexibility. Maybe another agency that I should introduce here is the Kenya Investment Authority, which works very closely with investors who approach Kenya and whatever they need. If they need immigration issues, they have a one-stop center. If they need tax issues, they have a KRA person. If they have opened a park and they have a factory, they have electricity issues, they have the Kenya power agents on site in the one-stop center. So in short, if you are able to access the Ministry of Industrialization, it's a manufacturing issue, whether at SME level or at a medium, large manufacturer, we are able to support you. One more thing, sorry, Kenya is a member of the EAC Common Market. That limits the tariffs that we are able to charge because of the agreement in the EAC region. But we are trying to look at how to adjust some of the tariffs to give our manufacturers a better cost of doing business and a better environment. But of course, you know what it takes when you have these multilateral agreements. Engaging takes a while. So we are looking at that. Excuse me. And one more, the government procurement document that I talked about, if it's not on the website, I have not checked, I can share it with the PATH team. I have a soft copy. I'll share it with the PATH team. Then you can get access to it so that we know what is locally produced. And then we deal with the aspect that Dr. Machogu so eloquently mentioned. Kenyans, we need to trust our own manufacturers. If we have 128 products that are ready for procurement done locally, we have 50% of the business in COMESA. Why should I reject whatever is made in Kenya? So let's support our local industry. And you can see during this COVID period, that's what has carried us to. I tell you right now, there's so much protectionism in terms of the industry out there. And people have written and said, we will not release A, we will not release B. So how much can we do locally so that we only depend on what we really must get at the import level? So that opportunity is there and government is ready to support. With that, I will say also that we have other facilities like the government, I think maybe Dr. Machogu mentioned the industrial parks. He mentioned the EPZ, but we have also industrial parks and special economic zones, which allow you to make your product, but sell to the local market as well as export. The EPZs allow you to offload only 20% into the local market, but 80% must go into export. So those outfits are the ones we're looking at the incentives regime to see how to best make them suitable. And already we have seen strong indications that their investors were ready to come aboard. So we are open to the issues of joint ventures. We are also open to the issues of investor coming in, and we are open to the issues of local investors just partnering with other on a G2G arrangement. Thank you very much.
Thank you so much. Thank you for that elaborate explanation. Quickly to Dr. Karanja. Dr. Karanja, you have very few minutes, my apologies, but I would just ask that you quickly go through. I'm seeing even 2 more questions, but first handle the ones that came through, kindly.
Thank you. So the question I think was, how do we deal with local innovators in Kenya, in academia? Is that correct?
Organizations have been named as incubator as an early your organization. How do you work with innovators within the research institute and academia to give life to their innovations and especially navigate? I know that one you brought in when you are talking, but now let me build it up with the next question that came in. Individual innovators are wary of organizations taking away and patenting their innovations. What is being done to build confidence among such innovators to work with investors and organizations to bring their innovations to the market? So you can put those together as you respond.
Thank you. And actually, yeah, it sounds like the same question. So it's very simple. Actually, we partner with the research institutions and the universities to support innovators. But for the innovators, the way we work with them is they do need to wear 2 hats. So we need to have a breed that we call entrepreneurial scientists or entrepreneurial academia that do not quit their jobs in academia, but they're able to create, to register startups and partner with the university to spin off their R&D outputs into that startup. So I, as Dr. Karanja, if I'm a scientist at University of Nairobi or at Cambridge or wherever, yes, I'm employed there. And so it basically means that any intellectual property that I create is owned by my employer. Now, in a country like Kenya, we don't have industry that exists that can license the patent. So we have pharmaceutical companies, manufacturers, but they're doing generics. They're not doing innovative drugs, and for many reasons. So if you want to be able to commercialize a drug, you really need to be able to create the industry yourself. You need to create a company yourself. As Wildgrow, we're able to come in and we're able to provide catalytic capital to help you to achieve the various proof points that venture capitalists and private equity investors must see in order for them to invest in that company. So in terms of the intellectual property, we would expect you to patent it. Ideally, your employer, the university or the research institute should patent it. The second part of it should be, you need to create a company that licenses that intellectual property and brings that IP into your company. And then now to start the hard work of de-risking the technology and de-risking the commercial promise of that innovation. So it has to be de-risked both technically and commercially, but that requires you to set up a spin-off company. And we'll work with you at the university or at the academia, at the research institute. So you don't need to be thinking, how do I get the labs that I'm used to? What have you? We basically need to be able to have a co-incubation arrangement with your employer so that we're able to leverage existing infrastructure. And as you show market traction, eventually you'll be able to now scale up and out.
Thank you. Thank you so much, Dr. Karanja. I'm seeing we are a minute after time, and thank you so much, panelists, for the informative sessions we've had. The information you've shared is very valuable to not only the civil society, but to the general public. I want to thank you all. I want to express my gratitude to the speakers for their time and expertise today. It was great hearing from your perspective on, the different ways in which we can leverage on local capacities and to strengthen, local markets. And for those who attended, thank you for your engagement and thoughtful questions. Unfortunately, we could not, get to all your questions, but we hope you'll continue to follow our series of webinars to hear more from our experts. Thank you very much, and God bless you. Bye-bye.